of this presentation is to explain the transducer-dependent variables of the 3x4 scanning quality checklist that should be used in daily musculoskeletal ultrasound clinical practice. Using this checklist will ensure that you scan your patients in a critical and qualitative way and that you lower the risk of false positives and false negatives. The transducer variables are the third point on our 3x4 scanning quality checklist. The 4 transducer variables to constantly check and adapt are the positioning, the handling, the angle, and the optimization. Let's go over them one by one. The image should be orientated in a reasonably consistent fashion. By convention, when a structure is imaged longitudinally in a long axis view, it is typically orientated so that the left of the screen is proximal and the right of the screen is distal. There is generally less convention with respect to imaging structures transversely or in short axis. Some maintain the left side of the screen as the anatomic right, and others orientate the left of the screen as the medial aspect of the body. It is probably best to perform transverse or short axis live scanning in a position that makes sense with the orientation of the patient with respect to the screen. For example, when the transducer moves in the medial direction on the body, it should move the same direction on the screen. In the upper left screen of ultrasound systems, a little symbol can be found. Each ultrasound system brand shows a different symbol, but the concept is the same in all. This symbol correlates with a marker on the side of the transducer. In some cases, it's a small LED light. In other cases, it's just a small plastic ridge, as seen in this image. Everything which is scanned with this side of the transducer will be visualized on the left side of the screen. To conclude, I mentioned on the previous slide that when a structure is imaged longitudinally in long axis, it is typically orientated so that the left side of the screen is proximal and the right side of the screen is distal. To obtain this, the transducer should be placed on the skin in such a way that the transducer's LED light or plastic ridge points to proximal, because only then will proximal parts be visualized on the left side of the screen. This slide shows a longitudinal scan of the long head of the biceps brachii. The transducer is placed on the skin in a way that the marker on the transducer is pointing to proximal. The obtained ultrasound image on the right shows the intertubercular groove, the proximal part on the left side of the screen, and the humeral shaft, the distal part, on the right side of the screen. In a previous presentation, you have learned about how to handle the transducer. We have dedicated a separate presentation to this topic because handling a transducer correctly is extremely important to scan with good quality. In the Handling the Transducer presentation, we gave you lots of tips and tricks on how to hold a transducer. For example, these two pictures demonstrate the incorrect method of holding the transducer for optimal stability and control on the left side, and the correct method on the right side. In the left image, the sonographer is holding the transducer too far from the base and does not have contact with the patient's skin. In this way, the transducer will be unstable and it will be difficult to follow a certain anatomical structure over a longer stretch. The image on the right, the appropriate hands position, shows a sonographer with a comfortable grip of the transducer at its base, with the thumb, index and long fingers, while maintaining good contact with the patient with the small and ring fingers and ulnar portion of the hand. Make sure that you have seen the Handling the Transducer presentation. Scanning with the correct transducer angle is probably the most important thing of the whole 3x4 scanning quality checklist. Scanning needs to be done perpendicularly, under a 90-degree angle. This is important to avoid the artifact anisotropy. In case of anisotropy, there will be, due to the incorrect angle of incidence, a smaller return of sound waves to the transducer, which results in decreased clarity of the image. The yellow arrow points out the transverse pollicis longus tendon, which is scanned under approximately 81 degrees angle. Please note that the tendon is very hypoechoic due to anisotropy and that it's almost invisible. Looking at this image, you might think that there is no tendon at all and that it's torn, but it's just obscured due to the anisotropy. The tendon becomes slightly more visible when tilting the transducer more towards 90 degrees. Because the tendon is being scanned at approximately 84 degrees, it still looks hypoechoic. A common pitfall would be to think that the tendon shows degeneration instead of realizing that the anisotropic artifact produces the hypoechoic color. Scanning at roughly 87 degrees shows a proper tendon, but still more hypoechoic than it should be, possibly leading to the assumption that it's not of 100% quality. Scanning the tendon perpendicularly under a 90-degree angle will lead to the most optimal image. Please note that the tendon is beautifully visualized with maximum echogenicity and that we can conclude that the tendon is healthy. Overshooting the tendon, for instance scanning under a 93-degree angle, again results in a little bit more anisotropy. If this happens, tilt the transducer back to 90 degrees. The angle of the transducer's position is always referred to the anatomical structure that you have to scan. It's not related to the skin. This image shows a transducer that has a perpendicular 90-degree angle with the skin. But the artery and nerve, which it should scan, are scanned under an incorrect angle of incidence, leading to anisotropy. If you would like to scan this artery and nerve optimally, then the transducer has to be tilted to the point that it scans the artery and nerve perpendicularly. Always search for the highest possible echogenicity of an anatomical structure or tissue. If the echogenicity is maximal, only then you know for sure that you're scanning perpendicularly. Following a certain structure or tissue over a longer stretch results in constantly adapting the transducer angle to the new location. Ultrasound is a very dynamic technique. All these variables should be adapted and optimized to every new movement or new transducer position. You should know these variables by heart and constantly and automatically, almost robot-like, be optimizing them to acquire the best images. Therefore, one of your hands holds the transducer on the patient, your other hand is near the ultrasound system buttons. All system settings are optimized with the one hand, while the other hand adapts the transducer position to the regions of interest. Thank you for watching.